Assalamu alaikum. This article talks about the effectiveness of one visit and two visit endodontic retreatment of teeth with persistent secondary endodontic infection, a randomized clinical trial within 18 months of follow-up. This article done by Cassia Toia and her group at January 2022. One of the main goals of the root canal therapy is to eliminate the infectious process by reducing the microbial content to the level compatible with the healing of the preapical tissue. So some studies support the heterogeneous etiology of a persistent or secondary infection, where no single species can be considered as a main endodontic pathogen. Instead, multiple bacterial combinations act synergistically to increase their virulence, playing an important role in disease maintenance. Moreover, recent technology breakthrough include new irrigation device and instrumentation system have allowed one visit root canal treatment, shortening the time needed for treatment and avoiding intra-appointment contamination. So the aim of this study was to compare the endodontic retreatment root-filled teeth with post-treatment apical periodontitis performed in one visit versus two visits in the reduction of the microbial load, LBS and LTA level, and the preapical lesion volume after 18 months of follow-up using CBCT analysis. According to the methodology, there is 323 cases assessed for eligibility, and 283 cases were excluded due to not meeting the inclusion criteria. There is only 40 cases available for this study, and it is a single blinded study which is distributed into two groups, 20 per each. First group, it is one visit group, and the second group is the two visit group. And the primary outcome was the measurement of preapical volume reductions that performed through the CBCT analysis preoperatively and after 18 months of follow-up. The secondary outcome was the quantification of the microbial load, LBS and LTA levels during endodontic retreatment phases in one visit or two visits, and there is a 4 cases drop out in first group and 2 cases drop out in second group. According to the result and regarding to the determination of cultivable bacterial count, there is no significant difference was observed between groups regarding baseline sample, but in the sample obtained after retreatment protocol, the one visit group showed a significantly lower microbial load compared with the two visit group, with a significant difference between groups. And regarding to the quantification of the LBS level, at the baseline, all the cases have detected endotoxin in the root canal, but in the both group after treatment, endotoxin level were significantly lower after retreatment protocol in both groups, with no significant difference between groups. And regarding to the quantification of LTA, no significant difference was observed between groups at the baseline value, but after retreatment protocol, the two visit group showed a significant lower level of LTA compared with the one visit group. And regarding to the CBCT analysis of assessing the preapical lesion volume, that found both groups exhibit a statistically significant reduction in the preapical lesion volume between a preoperative examination and 18 months of evaluation, with no statistically difference between groups. By considering a preoperative sign and symptoms, time and quality of filling from previous treatment and case complexity, and is a restorative concern, clinicians will be able to select the most appropriate retreatment modality to address their patient endodontic need. In conclusion, 18 months after endodontic retreatment of root filled with a post-treatment apical periodontitis, no significant difference were observed in the reduction of the preapical lesion volume between both groups, and using calcium hydroxide for 14 days in second growth. And even remaining content of the LBS and LTA bacteria, it was possible to observe a significant reduction on the volume of the preapical lesion in both groups after 18 months of treatment. And I thought 4 or 5 years of follow-up might be necessary to adequately evaluate healing. And thank you.